Good day. I'm Dr. John Ward, Director of the Coalition for Global Hepatitis Elimination at the Task Force for Global Health in the United States. It's my pleasure to be having a series of conversations with our hepatitis elimination champions for 2021. It's my pleasure today to introduce you to Dr. Muhammad Ali from Bangladesh, who's been doing remarkable work both in his medical work as well as in his community work to advance progress toward hepatitis elimination. Hello, Dr. Ali, and congratulations and thank you for your work.
Thank you. Thank you.
I've had the pleasure of knowing Dr. Ali for some time, but please tell others a little bit about yourself. Pardon me, your training and how you got so interested and committed to improving hepatitis prevention, testing, and treatment.
Thank you, John. I'm very happy to have conversation with you. Actually, I'm a surgeon, hepatobiliary and liver transplant surgeon. And while I was working in the Queensland Liver Transplant Center in Australia, then I saw that this hepatobiliary surgeries, there is those causing by liver cancers or having cirrhosis. Either the liver surgeries are going on or liver transplant are going on. Most of them are preventable. So I thought then when I will go back to my country, I will start two things. That is, I will work for curative treatment, that is for the supports for hepatocellular cancers and other liver diseases, surgeries, as well as, I will start liver transplant in Bangladesh, and side by side, I will work for the prevention, because as I know, there was about more than 60% of the liver disease are preventable. So I will do work for prevention of liver disease. Right? So when I came back to Bangladesh, I first started hepatobiliary pancreatic surgery in an institute. And same time, I started a organization named as Liver Foundation of Bangladesh for prevention, treatment, education, and research on liver disease in Bangladesh. So in 1999, my activity was twofold. One was curative for liver surgeries, and also for prevention of liver diseases. So, under the banner of Liver Foundation, which was subsequently government recognized to be a National Liver Foundation of Bangladesh. After working and making a team work on hepatobiliary pancreatic surgery, in 2010, I made the first successful liver transplant in Bangladesh. And same time, the activities of my foundation was continuing. And when this awareness was continuing, particularly for hepatitis B and C in Bangladesh. And at that time, I'm telling about 1999, 2000, there was no much organization globally for this working for prevention of this viral hepatitis. In 2007, I got a message from Charles Group that we are forming a group, an organization for prevention of viral hepatitis in the world. Could you please join this? Because you are doing a lot of work by this time for screening and also helping the peoples for treatment. Then I gladly accepted his invitation. And in 2007, when World Hepatitis Alliance was formed, At that time, Charles Gould was the president. Myself and joined with the Liver Foundation, joined the World Hepatitis Alliance. So everything now got the momentum when I got a global partner. Before 2007, I was alone. 1999, 2000, I was alone in Bangladesh. And now I got a global partner. And this alliance started to give everywhere, giving team-based, that is this based titles. That first thing was, I remember that MI number 12, that is whether I am one of the 12 persons having hepatitis B or C. So with that campaign, I started with the alliance. And there was one, that is a public health panel was formed by, I think, 12 members, in which Baruch Blumberg, the Nobel laureate and inventor of the vaccine, was a member. So Charles Gould invited me to be a public health member of the public health panel of World Hepatitis Alliance. And with that, in 2010, I think Brazil brought a proposal for making this World Hepatitis Day on WHO. I think, so far as I remember, it was 63rd World Health Assembly accepted that resolution, and the day was 28 July, according to the birthday of Professor Baruch Blumberg, in that resolution I was one of the signatories. And all those theme-based awareness campaign was continuing in Bangladesh. In Bangladesh, what I emphasize that our country has got a lot of problems, particularly this hepatitis B and C. And there was no other organization working for control of viral hepatitis in Bangladesh. We have got the population of about 150 million, more than 150 million, and 65% population is in the rural areas. And when I went to the rural areas, I asked a lot of people, said they don't know what is hepatitis, that is not, and what is hepatitis B or hepatitis C. They were silently suffering and they were dying. This is very, very gloomy appearance when I met with the common people. So I made the program that I will do something to reach the common people at the grassroots level. If I can reach the grassroots level people, common people, then I can make it aware, I can pass the message. And first I make a sketch poster with how hepatitis B C is spreading in our society. And that sketch poster was very much highly publicized in the common people. When they look to the poster, they could understand then how this hepatitis B and C is spreading among them. And I took I share everything with the World Hepatitis Alliance, and World Hepatitis Alliance was very much cordial and very much positive for my activity and other things. And you will be happy to know our activities most of the time get the cover stories of the World Hepatitis Alliance. Even then, now even getting a lot of coverage by the World Hepatitis Alliance. And I went to attended the Glasgow meeting when Charles Gould was there, and I have the very constructive discussion with the members. First World Hepatitis Summit was there. And the second summit was in Brazil, and where I presented a No HEP campaign in Bangladesh. And another thing is how to create awareness on viral hepatitis. My slide presentation is still available in the No HEP website. How I started this campaign in Bangladesh and how grassroots activation. Main thing is the grassroots activation is the main. My concept is if I can aware the common people about the viral hepatitis, then there will be prevention of hepatitis B and C, and the public will aware. The representative is there, when it is there, they will see that the peoples are going to be aware. So definitely it will come to the parliament, and definitely it will go up to the ministry, and government will aware then these things are going on. So instead of starting from top, I started from the grassroots level so that the common people will be aware. And another thing is this: you go to the government or parliament or something like if my common people become aware, if they know what is hepatitis B, if they see and how it is to be prevented, and what is to be done during pregnancy state for prevention of the vertical transmission to their child and other things, then my work is already done. Government, whatever they coming or not, yes, may come later on, but my work is going on. So how I am doing these things? I have created a network, is known as No HEP network, and there was activists, volunteers throughout Bangladesh, and they go. I centrally control with them with the brochures, text message, and other materials, awareness materials. They convey this directly to the common people with their own language, with their own dialects. And so people are going to be aware. That is the main thing. Now, it is continuing even in COVID-19 pandemic by text message. And I have made an apps, No Hepatitis in Bangla, so that in that apps, anybody can download these apps, and everything is there. We're starting from hepatitis to liver transplant. Everything is there in this apps. So that apps is a very good thing because it is in Bangla and common people can understand very well. Second thing, what I am doing to reach the common people, unreachable people, I arrange hepatitis, World Hepatitis Day, okay, at 28 July, okay. But our activity continues throughout the year. Our activities are not that one day work for the 28 July World Hepatitis Day, do this, and then 29 July, nothing. No, every day the work is going on. So I designed some programs in the light that suppose regional hepatitis days. Suppose it is in Dhaka capital. I arranged hepatitis day in another district known as Chittagong, a port city. So that is known as Chittagong Hepatitis Day. One day will be there. I will go there. My whole that is this foundation machinery and will be there. We made some that is cooperation with the government authorities, deputy commissioner, divisional commissioner, local parliament members, and we go there. First thing, one thing we do, we make an awareness rally in the city on that day. In the morning, there will be an awareness rally about hepatitis B and C. Second thing, there are orphan children of that there, maybe 100, 200, 300, 400 orphan children in these children homes. We screen them, we made them. First, we make an awareness campaign with them. I gave, or I have got the other persons, they gave a talk with these children about hepatitis, and their teachers and their guardians, whatever, the orphan children. And then we screened them. We made, that is the free screening, as well as we vaccinate them for free hepatitis. By this time, in this regional context of Bangladesh, very real, I have tested and vaccinated more than 6,000 orphan children throughout Bangladesh. So they are very happy, and it is continuing. I started this since 2007. And then what I make on that day, we also make a program, awareness program in an academic institute there. So suppose a college or an university, so we go there on that day, same day, and make an university. So one awareness campaign on that day, suppose screening is there, the awareness campaign is there, rally is there. So by this time, we have covered most of the districts by covering that this World Hepatitis. Suppose Chittagong Hepatitis Day, Dhaka, Sylhet Hepatitis Day, Rangpur Hepatitis Day, according to the division, subdivision, whatever the possible is there. Another thing we started doing is the patients conference, hepatitis B and C patient conference. What I thought that it is better to give the message of hepatitis B and C to the patients directly and their families. So I arranged hepatitis B and C patients conference, calling the patients to come to a hall auditorium, and on the dais there will be hepatologists, renowned hepatologists of the country on the dais, and the patients will ask their, at that time we gave a awareness lecture, hepatitis B and C by one or two hepatologists. And then there will be direct question and answering by the patients and their relative with the hepatologist sitting on the dais. By this time, this is very wonderful, and I got very much encouraging result and a lot of appreciations, not only from Bangladesh, even from the World Hepatitis Alliance. Then this kind of things nobody was doing. The direct patients conference between the interactions between the patients, and a lot of patients come. We cannot accommodate. Suppose hall is 400 patients, 500 patients, we cannot accommodate. The hall becomes full by this time, and they remain standing, sitting hours together. It indicates that they have got the very much inquisitiveness about knowing about viral hepatitis, and because they are suffering, and suppose husband is suffering, wife is suffering, so they like to know directly from the hepatologist what will be the consequence of what is going on. This is very encouraging things. Second thing, I started treatment with free treatment with the for hepatitis B and C patients under Zakat Fund. Zakat, you know, in Muslim, there is a voluntary that is the contribution for your annual income. You must have to at the end of the year, you must have to contribute part of your income earning to voluntary contribution to the poor, for the diseased, for welfare of the other people. It is compulsory. So I approach the peoples, my colleagues, friends, other things. Then I like to create a Zakat Fund for treatment, for free treatment of that is hepatitis B and C, particularly underprivileged, young. Suppose they are universities going or college going students, even not only with students, they are active members of a family, earner of the family, and suffering from hepatitis B or C, they cannot get the treatment. So I started Zakat Fund, and I got very good response. When I make an announcement that this time we will give enroll the patients for free treatment for hepatitis B and C, Zakat Fund, within 2-3 days, 500, 600 requests come for the enrollment. So I'm continuing this with full swing, and they're very much very happy. And even in this COVID-19 pandemic, they are everything free. They are consultation free, investigation free, treatment free. Even if they cannot come, we send the medicine to their home, everything free, of course. Even there was a lot of problem in this COVID-19, particularly when it was started. And still now it is going on. Our country is under lockdown now. So we continue our this medicine supply to these Zakat beneficiaries of hepatitis B and C. Really, it is encouraging, and I am trying to boost up it very much. And another thing I came to know that there are Rohingya refugees. This came from Myanmar, and there are a lot of problem with them. And there's finally the migrations. After the migration, I think more than 1 million refugees are there. First I came to know there are more than 30,000 pregnant women is there. So what I was thinking then, all right, is it possible to conduct a screening test of some of the pregnant women so that if those will be positive for hepatitis B, I will provide immunoglobulin and vaccine to the neonate so that the vertical transmission of this have be halted among these Rohingya newborn childs. Then I made this and it was, first I chose 300 pregnant women. And it was really surprising that they have got the high prevalence of hepatitis C. B was only 4% or so, something like this, but C was more than 8%. And it was a very much concern. And I first presented this finding in my presentation in the World Hepatitis Summit at Brazil. And it was really, everybody was showing concerns, and this woman is in the, staying in the camps, very unhygienic condition, delivering in the, most of them, they are home delivery or very unhygienic, unhealthy conditions, and they have got the hepatitis C, they have got the hepatitis B. So when I delivered this in the summit, really I was also impressed by the showing the concern of the world bodies that really something should be done. When I back home, then I think I will make a bigger screening testing of these Rohingya refugees. Then I conducted subsequently testing of 20,000 Rohingyas among them. And it was found they have got the high prevalence of about 16% female having hepatitis C. And really it's alarming, and I am working to publish a paper on that subject. It is under preparation, and it will be the first global report of such a high prevalence of hepatitis C among the Rohingyas, because this is one problem. It is they have got this disease themselves is a problem, and another thing is because in our country, in Bangladesh, the hepatitis C is less, about around less than, we say, 1% only. And if they have got the 15–16%, some say 16% hepatitis C. So it is really a problem for our nation also, because they are trying to enter Bangladesh in very many ways unlawfully, and trying to mix in our societies. And another thing, their return to Myanmar is uncertain. And they are in the camp and very unhygienic condition, remaining with this high prevalence of hepatitis C as well as B is untreated. And really, I think world communities will come forward regarding this issue. Another thing, we conducted testing of pregnant women for seeing that for prevention of vertical transmission to their newborns, particularly in children homes and when they are women organizations and others. So we found that about 3% of the pregnant women having hepatitis B in Bangladesh. So we provided vaccine as well as immunoglobulin to those having positive Hep B for prevention of vertical transmission, and it is already continuous. Another thing, aspect of our activities are there, although the high-risk communities, but those one group is the that is thalassemia group. Thalassemia, there's thalassemia receives multiple. Thalassemia patients receive multiple blood transfusion, and they have, we are finding that they have got the high prevalence of hepatitis B and C. So we treat them free, and we are enrolling them for free treatment under Zakat Fund. That means we are making awareness at the grassroots level, as well as we are continuing micro-elevation in Bangladesh, because I think that in the scenario of elimination, when I consider, and that when this, there is this World Health Organization declared in May 2016 this elimination strategy, and at that time 194 member states were there, and they all agreed for elimination, that they agreed for elimination. But unfortunately, it has been seen that only 11 countries nowadays in the track for elimination. So out of 194, if only 11 countries are in the track of elimination strategy. Now, so it was really a concern even before a lot of meeting, lot of discussion was going on with the alliance. Then only 11 countries, so what is to be done, how to proceed for the elimination, and day is already coming, only 10 years now. Last year we were discussing, John was there, that only 10 years to go and where we are. After that, the disaster, this corona, that is pandemic has come. And after pandemic, everybody is realizing the life and death question of the employee or worker, activist, a lot of people, even 2-3 people, the main person of my National Liver Foundation is already there. My treasurer is dead. My president is dead. So really disaster is going on everywhere, not only in Bangladesh, everywhere. In that situation, what I think that we should give special emphasis on micro-elimination, particularly these vulnerable and high-risk groups. Suppose these patient communities, what we have made, for the patient communities, we are making 2 things. One is the patient conference. Patient conferences, we are directly informing them, and we hope we will continue even with this online or virtually, these patient conferences, and we are providing free treatment for the hepatitis B and C under the Zakat Fund. So what I think in this micro-elimination in Bangladesh, I will reinforce all these things, even in COVID, corona, that is COVID pandemic. Another thing is this, children, also another sector, that is this prevention strategy of the micro elimination is the children. And then the children is coming from getting infected either from the mother, from vertical transmission, or they are getting horizontal transmission after confinement. So our work is going on for information, for awareness of the women folk through gynecological societies, women organizations. Our awareness campaign is going on. And also we are conducting these women institutes so that the message can be passed about the testing during pregnancy and vaccination of the neonates, of the infected mothers. Most important and final important thing, what I think, that every aspect of management of hepatitis B has got a cost involvement, starting from the testing, starting from the investigations, follow-up, interventions, and drugs. So everywhere we are trying to convince the government authorities, organizations, and even pharmaceutical companies to decrease the cost of the drugs and other drugs. The DAS is there for Hep C. Hep C is the problem. One problem is there is no vaccine, and second thing is the DS drug is also costly, particularly in my country. So we are working hard to minimize the cost of the DS so that easily people can easily afford it. We are continuously pleasing the government for making this elimination strategy to fulfill the 2030 goals. Even in the last World Hepatitis Day message, the Honorable President, Honorable Prime Minister, Health Minister, everybody made commitment in their message. Then yes, we'll work for elimination, and they also asked the nation also in our message that yes, the non-government organizations will work together with the government for fulfilling the elimination 2030 goals, make successful. What I am thinking is this: government is coming or not, I should continue two things. One thing is the grassroots activism should be continued. If grassroots activism is successful, more will be successful, more people will be aware. Government coming, if the government come, it will be a complementary for the government. When the government will come with a lot of proposals and plans, other things, they will find that the government, the peoples are already aware. Previously, they know about the 6, 7 years, 8 years back, they were not knowing what is hepatitis B and C. Now they know what is hepatitis B and C. So it will be a complementary to the government. And if the government does not come also, my purpose of awareness of the people, to aware the people, common people, aware the pregnant women will be solved. So I will continue this, whatever method. Second one is the micro-elimination. I will not wait till 2030 when the 2030 goal will be fulfilled, that 90% reduction of that 80% this, 100% this. Okay, it will be coming, no problem. If somebody can come, government can bring, okay. But my micro-elimination will be, if the vulnerable communities, vulnerable societies, high-risk societies, these drug addicts, these thalassemia patients, these patient groups, these children, these pregnant women can aware. Blood transfusion, if I can make blood transfusion, I am conducting campaign in the blood banks also for safe blood transfusion. If these things are personally can be done, it will be, my work will be done. People are going to be aware, and when the government will come with the policy for 2030, it will be a complementary. Government will find then already the people aware, and it will be very good, easy to fulfill all the all the requirements of the 2030 goals. So our organization is working every day, and we are dedicated and reaching the unreachables, underprivileged communities. And whenever these peoples having hepatitis B and C, they are coming to us. And when wanting something, they need treatment, their investigation, they have got no that is the facility, or they have got the deficient money for purchasing medicine and other things, we are providing them. Whatever the things we provide them, and we'll continue this with our, and it's a non-profit organization working for prevention, treatment, education, and research on liver disease in Bangladesh.
Thank you very much.
Thank you.
Thank you so much. That was a great overview of a full description. And I think what comes across loud and clear is your focus on health equity, really focusing on the grassroots approach, the marginalized populations, the high-risk populations. And that's really the ultimate goal of disease elimination, is health equity, assuring that everyone in a country is receiving the same benefits of these interventions that are truly life-saving. You know, I salute your work of being the first to conduct a liver transplant in Bangladesh, but, you know, more broadly, all of the great work you're doing throughout the community. And I may be biased as a public health official, but I would say that you probably have saved many more lives from your community work than the number of people that you've been fortunate to benefit their health with liver transplants. And I salute you going beyond your, your technical expertise in medicine to go beyond and really work within the community. So really, it was really inspiring. It sounds like you're just only getting more and more involved in different ways. So thank you again. You brought up a number of ways that I think the coalition and myself would like to work with you, and I will come back and be in touch about that. But I think we have plenty for our profile of you for the as a hepatitis elimination champion. So we'll stop here, and thank you again. Really fantastic to for you to take the time to describe everything you're doing.
Thank you, John, for these kind words, and I think it will be an inspiration, and this award will reinforce my activities in coming days. And my followers, I have I have got a lot of hepatobiliary and liver transplant surgeon I have created in Bangladesh. Now by this time, I think under my care, about 13 surgeons are working in Bangladesh. When 1999, yes, when 1999, there was nobody except me. And they are doing a lot of hepatobiliary pancreas surgery and liver transplant is going on. So, and with this award, and I have got a lot of patients, you are understanding community, I'm going here to here, this district to this district, this division to this division. Even with this busy schedule, I myself go there, attend this, there is this regional hepatitis days, for one day program in these remote areas for awareness of the common people. And I get really love and respect from the community for the people. And I work for the people, I work for the people, and I work for the people.
That's great. Thank you so much. We'll stop there again. We'll be back in touch, but